All right, guys. Today we are going to be um, lecturing on the muscular system. The learning objectives are as follows. Take a few seconds to look those over. Again, these are some of the major roots that you're going to see in the musculoskeletal system. So, types of muscles. There are smooth muscles, which are on the walls of the hollow organs and ducts. They are involuntary, meaning we do not have conscious control over the smooth muscle, and they are responsible, among other things, for peristalsis. Peristalsis is the squeezing of your intestines to move the food and nutrients through your intestines. The cardiac muscle is what makes up the myocardium, or the heart tissue. It also functions involuntarily and is, of course, responsible for the pumping of the heart. And lastly, we have skeletal muscle. They're the ones that attach to the bones that we studied in the last lecture. They are responsible for the voluntary movement as opposed to the involuntary in the cardiac and smooth muscle. That means we do have conscious controls of those, and they maintain our posture, and they also are the thing that generate the heat to keep us at 98.6 when we're at homeostasis thermogenically. Okay, muscle structure. In general, they're held together in fascicles. A fascicle is a working unit of muscle. Fascia is a connective tissue that covers the outside of the muscles, and tendons are what attach muscles to the bones. For a muscle to contract, they first need to be stimulated by the motor neurons of the nervous system, and we will be studying the nervous system before too very long. Acetylcholine is the chemical signal that prompts the contraction, and the two systems that interact with each other are actin and myosin. And we need ATP, adenosine triphosphate, and calcium for the contraction to work. And if there's a partial contraction, a muscle is said to be in tonus. Muscles work together at joints. The agonist is the one that is contracting to move a limb, and a synergist is something that assists the prime mover or the agonist. The antagonist is the one that has to relax for that action to happen. So for instance, if you are going to move your radius and ulna towards you, you would contract the bicep. The bicep becomes the agonist in that case, and the triceps on the other side of your humerus become the antagonist. And then when you extend your hand back away from you, the tricep then becomes the agonist, and in that case, the bicep becomes the antagonist. The point of origin is where the muscles attach, and it's a point that is stable on the skeleton. And the insertion is where the muscle is the muscle attachment point in the moving part of the skeleton. So the stable part is the point of origin, and the moving part is the point of insertion. So here we have a diagram of a nerve releasing acetylcholine into the gap between the muscle and the nerve right here. And these little green dots coming out of the vesicle is the acetylcholine, if it's blowing up over here. Once the muscle cell senses the acetylcholine, the myosin and the actin form little fingers that bridge across to each other, and they start contracting and move the muscles together. So as I mentioned earlier, in this case, when the hand is being moved towards the body, or you're flexing your arm, that is the bicep, that is the prime mover, with the synergist being the brachialis right there, and then the triceps is the antagonist. So muscles are named by their location, the direction that the fibers go, the size and shape of the muscle, the number of attachment heads, and its action. All those things go together for naming a muscle. This is a diagram of the major muscles looking at the anterior view of the body. So you'll want to learn these. There are a lot more than this, but if you're familiar with these, you'll be just fine for the purposes of our class and for the purposes of the MA or Vet Tech program, certainly. Okay, I won't go over all those with you, but if you ever do want to study those or have questions about pronunciation or what they do, reach out to me anytime. I'd be happy to assist you. And here they are, the muscles looking at the posterior view. So key vocabulary words we've covered: acetylcholine or ACH, actin, agonist, antagonist, cardiac, fascia, all of those, neuromuscular junction. We did indeed. So in the clinical aspects of the muscular system, myopathy is any disorder of the muscles. Again, here we see myopathy being a disorder. You can look at electromyography to see if the muscle is contracting properly. You can also look for assays of enzymes in the blood serum by taking a blood sample. And creatine kinase, for instance, is released when there's damage to muscle. It comes out of the intercellular area and moves out into the blood. So muscular dystrophy is a hereditary disease. Duchenne muscular dystrophy is the most common. It is progressive, and it is a degeneration of muscles. So, and the muscle degenerates and wastes away. And as the muscles waste away, they get replaced with connective tissue and fat. And unfortunately, also cardiomyopathy, because the cardiac muscles get affected. Polymyositis is inflammation of muscles. Dysphagia is trouble swallowing, and again, cardiac problems. Cardiac tissue is affected as well. Don't exactly know why it happens, but in all likelihood, it has something to do with an autoimmune process. And we studied rheumatoid arthritis as an autoimmune disorder, and lupus LE, lupus erythematosus, is an autoimmune disease that affects the muscles. So derm we see with skin, dermatomyositis. You have erythema. Remember, erythema is redness. Dermatitis, inflammation of the dermis or skin, and a lilac-colored rash. Diagnosis by enzymes, electromyography, and muscle biopsies to take a look at the telltale signs of that particular disease state. Fibromyalgia has muscle aches, tenderness, stiffness, fatigue, sleep disorders, and it is notoriously difficult to diagnose and is often a diagnosis of exclusion. A lot of other things are ticked off the list as options before a person gets a diagnosis of fibromyalgia generally. So a mild exercise program and pain relievers. Muscle relaxers and antidepressants are what are used to treat fibromyalgia. And chronic fatigue, it's persistent fatigue that cannot be otherwise explained. Muscle and joint pain is what we'll be looking at here. And other immune disorders seem to crop up at the same time that chronic fatigue is being diagnosed. There seems to be some association with a viral infection, and it is also, again, notoriously hard to treat successfully. Myasthenia gravis is an autoimmune disease of the skeletal muscular system, and this works at the level of the neuromuscular junction, the release of the acetylcholine, and it is, again, progressive, and muscle power is lost as it cannot be stimulated at the point of the neuromuscular junction. Happens a lot in eye muscles and facial muscles early on. ALS, or amyotrophic lateral sclerosis, also called Lou Gehrig's disease. Again, another progressive degeneration of motor neurons, just like the previous disease state, and the muscles atrophy or waste away. So weakness, cramping, and it is inevitably leads to death. There is no treatment resolution for ALS at this time. You can stress your muscles, and you can over-exercise or repeat something over and over again. This is like, again, notorious in long-distance runners or other endurance athletes will cause damage in this way. And the soft tissue can be from muscle strain, inflammation, can actually tear ligaments and tendons with enough stress, and bursitis is an inflammation of the sacs between the muscles. Tendinitis, again, itis, inflammation of the tendon and the synovial membrane, like we studied in the skeletal system. Range of motion can be effective, along with symptoms of pain and fatigue. The treatment is RICE, rest, ice, compression, and elevation. And if it gets bad enough, steroids can be used to take down the swelling. Rotator cuffs in the shoulder girdle can be certainly damaged. Epicondylitis with golfers and tennis elbow use in those sports, and carpal tunnel is a occupational hazard for those of us who have to do a lot of repetitive motions like typing, pill counting, those type of things. You can get inflammation of the nerves in the wrist and can require surgery to make a little more room so the nerves can fit through. Again, here we have the rotator cuff that gets injured. See this in sports with throwing motions like baseball and football, but certainly baseball pitchers blow out their rotator cuffs all the time. And in carpal tunnel, here we have the medium nerve, we have the ligament. So as you can see, there's a lot of things going through the wrist in a very small area. And here's another longest tendon here that also needs to fit through there. So when this gets inflamed down in this area, you can get pressure on the nerve and cause unbearable pain and tingling to the point where the hand can be almost useless. Of course, you can pull a hammy, get a shin splint, or if you run more than your body is ready for, you can inflame your Achilles tendon. on the back with your calf muscle attaching to your heel. So here are some key disorders: ALS, CFS, Myasthenia. We saw all of those. And then creatine kinase is the enzyme that can be found after the muscle is damaged. CK, creatine kinase. Here are some more words I'm going to say. Creatine, glycogen is the main sugar fuel source for muscular contractions. Kinesthesia is the ability to be aware of where you are in space, like dancers and gymnasts have great kinesthetic awareness. And lactic acid can build up if muscles are asked to contract more than they're able to get rid of. It's a byproduct of muscular contraction. Okay, more terms and conditions. If you would be so good to look through these and learn them, you will be seeing them in your homework and your test. Your tests. And if you have any questions about these conditions and definitions, please look them up. I'd be happy to go into these even more further. And certainly this is an idea for someone's presentation. You can pick the muscular system and then pick a system like one of these to go into a little more detail. And take your time and look at these. You can pause this at any time. You don't have to go through at the pace I'm going through if you do not want to. You always have access to these in the slide sets. They're available in Blackboard. Anti-inflammatories we talked about, and the non-steroidal drugs, aspirin. A COX-2 inhibitor is one that is a non-steroidal, but it is more specific than the older forms and causes less stomach ulcers than ibuprofens and naproxens and those types of things. Yeah, there is your non-steroidal right down here: aspirin, ibuprofen, naproxen. Abbreviation, the main one, I'm seeing is acetylcholine. ALS we covered, CFS we looked at, creatine kinase, carpal tunnel, electromyography, fibromyalgia, lower left extremity, left upper extremity, so that'd be left leg and left arm, Myasthenia Gravis, neuromuscular junction, occupational therapy. There is RICE, rest, ice, compression, and elevation. Okay, and there we go, rotator cuff. Okay, I know that was a lot of material quickly, but what I'm finding with recording these lectures is people tend to stop them and internalize the information, write down the definitions and whatnot, return to them, so that they actually are taking much closer to as long as they take when I'm actually giving them in class as well. So please, and then again, if you are unclear about anything I'm talking about, I'm always available every day during our class time, during my office hours, to answer any questions you might have. Thank you very much, and we'll talk to you next time.